Okay, let's get into our topic. The hidden master organ, why treating your liver is fundamental to anxiety and depression. So before we get started, let's just talk about where the liver is located in the body and why you call it the hidden master organ.
Okay, thanks, Rudy. The liver is basically beneath your right rib, just tucked right underneath your diaphragm. And it's the master organ because in Chinese medicine, we call it the master organ because it's really responsible for most of the functions in your body, including blood purification, detoxification of drugs and toxins, and also detoxifies the toxins that are produced by your body itself. Your liver also produces a lot of enzymes, produces bile, so it's responsible for a lot of your digestion, hormone production, protein production, and it also helps with blood sugar storage and regulation. Not only that, it helps with immune cell activation and storage of vitamins and iron.
I can see why it's called the master organ. And you've mentioned a few things here that I know tie directly to anxiety. Iron, for example, it's a cofactor for making the neurotransmitters. And you talked about enzymes and then blood sugar. All of these things, play a direct role in anxiety. And I know we're going to talk more detail how issues with the liver can have a direct impact on some of the mood issues that we see. So let's go right into what it means to have a sluggish liver and how this can impact our mood and other areas in the body.
Okay, great. So your liver has a lot of enzymatic processes going on, and it processes a lot of toxins. So because of stress and different factors, your liver becomes sluggish because of excessive toxins. When your liver becomes sluggish, there's a buildup of more toxins in your body because there's less detoxification happening. With more toxins in your body, you get more inflammation going on. And with more inflammation, there's a larger demand for cortisol, which is produced by your adrenal glands. Now, most people with anxiety do suffer with some level of adrenal fatigue. So if you have more inflammation in the body from a sluggish liver, that means your adrenal glands have to work harder to produce cortisol, and so you basically burn your adrenal glands out even more. And with a cortisol imbalance that comes from adrenal fatigue, you end up suppressing neurotransmitters such as GABA, serotonin, dopamine, and melatonin, all related to anxiety and depression.
Okay, and then we also find that you may need more nutrients to get through all of this.
Yes, because now when there's a lot of toxicity in the body, there's a lot of blockage around the organs, and so not enough nutrients go to your organs such as your thyroid gland, your adrenal glands, and all the other organs. So the amount of nutrients you need for those organs to function better goes up, right? So the amount of food you're eating is really not enough to have optimum nutrition. And then also, when your liver is sluggish, it produces less bile. And when less bile is produced, you have poor digestion. And bile lubricates your intestines and your stool, and with less bile and less lubrication, you end up having more constipation. And when you have more constipation, of course, you have more toxin buildup, so there's more inflammation, and the cycle goes on. The other thing that happens with less lubrication and less bile production is you have poor digestion. When your food is not digested properly, it actually creates more damage in your intestines and creates what we call more leaky gut syndrome. And I think you're going to be talking about leaky gut in your summit. Basically, it's when you have gaps in your intestinal lining, which allows more toxins to go into your bloodstream and creates more inflammation in your body. The other thing is when you have a sluggish liver, you have poor digestion, so meaning less nutrients are actually absorbed in your body, which means less nutrition to create your important neurotransmitters such as serotonin, dopamine, GABA, and melatonin. And therefore, you can see why a sluggish liver means poor digestion and which leads to poor brain function.
Yes, definitely. And it just seems like we've got these little cycles going on here where one feeds into the next. And we know how important inflammation is, and we're seeing a big connection with inflammation and anxiety and depression, and this whole issue of less bile production. Can you just tell us what bile is and how important it is for fat digestion?
Absolutely. So bile is a substance produced by the liver, and it's released into your small intestine via the Gall bladder, and it has a lot of bile salts which break down fats, right? So your body cannot absorb fat very easily. It needs to be broken down into little droplets, and that's what bile does. And bile also has certain salts in it and properties which activate enzymes coming from your pancreas. So the combination of bile and pancreatic enzymes is important for optimal digestion. Bile also has a lot of toxins that are being released by your liver, right? So really, your liver releases toxins from your body into your feces through bile. So the release of bile is extremely important for detoxification as well as digestion, and actually cholesterol control as well.
Okay, great. So that I know you have a focus on Chinese medicine, and you talk about this sluggish liver and liver imbalance from a Chinese medicine point of view. Can you tell us a little bit about that? Chinese medicine is not an area that I'm terribly familiar with, but I believe that it's important to think about.
Absolutely. So basically, in Chinese medicine, we talk about Qi and energy, and blood, the movement of blood and the movement of energy. In Chinese medicine, the most common pathology we see with the liver is called liver Qi stagnation, basically the stuckness of energy within the liver. And that just means that the processes are not working so well. And with liver Qi stagnation, we often see hormonal imbalances. So for women, you'll notice a lot of PMS symptoms, gas and bloating during menses, breast tenderness, maybe some clotting with menstruation. And generally speaking, for both men and women, we'll often also see some constipation or gas and bloating, and irritability or impatience. And the reason why that happens is because, like, your liver is the master organ, right? And it also controls hormones. So if your liver is imbalanced, you will see a progesterone deficiency and usually estrogen dominance. And as you know, truly, progesterone deficiency directly affects the function of GABA in your brain. And so with liver Qi stagnation leading to progesterone deficiency, we will see increased levels of anxiety.
Great. And it's important that we keep this in mind, because we'll often see women start to notice that they're feeling much more anxious around their periods, or as they go into perimenopause, or even going into menopause. And this could be related to hormonal changes, which in turn could be caused by this sluggish liver, correct?
Absolutely. So in addition to hormonal therapy or whatever treatments they're doing, their doctor definitely needs to look at their liver function. Mm-hmm. And now Western lab tests will not necessarily show elevated liver enzymes, so most doctors will think there's nothing wrong with your liver. However, going to an alternative practitioner, they can give you certain herbs, which we'll talk about later, to help balance your liver function so you get less PMS symptoms and less anxiety with menstrual changes.
Great. Yeah, really important to think about the liver. Whenever I think of anyone with any kind of hormonal imbalance, you've always got to support the liver. It's so important. And in this toxic world that we live in, and with the stress that we have in our society, it's so important to focus on the liver, as you say. I'm really glad that we're talking about this, because I haven't heard many people talking about it recently, and I'm glad that you have a whole chapter in your great book, which is really great, by the way. I love the cover of the book. I just love how colorful it is and how it's got all these positive words on the cover. What has it got? Let me have a look. It says, feel good, easy steps to health and happiness, love, brain. It's got a big picture of the brain with words like positive and peaceful and confident. And I think it's important when you're talking about mood and overall health to talk about the liver. So I'm glad we're covering this topic.
Thank you, Trudy. Yeah, it's definitely a core, fundamental organ that needs to be treated for any disease, especially.
Yeah, yeah. Now, I want to just talk about lactate and the liver. So this is lactate and the liver. And not a lot of people talk about it, but there is a direct correlation with high levels of lactate and increased anxiety. So let's talk about that a little bit.
Great. Lactate now is basically lactic acid is produced when your body is producing energy with less amounts of oxygen. Now, lactate is processed by your liver and converted back to glucose. So if your liver is sluggish, it's not working well, the conversion of lactate doesn't happen so well. And high levels of lactate are related to a lot of diseases, including anxiety, Trudy.
Great. And there's actually some research supporting this, isn't there?
Yeah, there's tons of research out there. And in 2008, there was a paper published in Neuropsychopharmacology. And basically, they connected high lactate levels to panic attacks. And it's really well explained why panic attacks, basically when you have a panic attack, you have faster heart rate, faster breathing. And they saw a direct relation between these symptoms and high lactate levels. And the other thing that they showed is that when you have high lactate levels, your body resets itself, meaning that we have the sympathetic nervous system, which is the fight or flight or anxiety state, and you have the parasympathetic, which is the resting state. And your body, after having high levels of lactic acid, has a harder time going into parasympathetic or resting state. And also what happens is your blood pressure regulation changes. So instead of being at a healthy level, your body compensates and maintains your blood pressure at a higher level. It's almost like your body's trying to prepare you for another stressful event. Even though there's no stress anymore in your life, your body stays in that state. It's called the baroreflex resetting of arterial pressure.
Great. So it's like there's a lion chasing you down. And if you're in Kenya, that could be a real situation. We always hear about the lion chasing you. In Kenya, it could be the real deal.
Yeah, I think that's where they got the analogy from. Kenyan wrote his book.
I know. And we've got to think about why do we get these high levels of lactate in the first place. And I first came across this connection between lactate and anxiety when I was reading Joan Matthews Larson's book, Depression Free Naturally. And I write about it in my book. So I was really pleased to see that you write about it and you talk about it, because it's not something that we hear about often. And, we'll hear some things that you need to think about quitting when you've got anxiety. And you may think, well, why do I need to do that? But things that can actually contribute to high levels of lactate in the blood are sugar, alcohol, and caffeine. Food sensitivities can raise your lactate levels. There's even some nutrients like niacin and B6 and B1, calcium and magnesium that can actually raise lactate levels. So if you're deficient in these nutrients, and as you heard Ameet saying earlier, when you've got a sluggish liver, you may not be able to use all these nutrients. So it's really important to think about some of these things that can cause the high lactate in the first place, and then remove those so you're not going to have that issue with the lactate. Am I missing anything there?
No, you're absolutely right. Because what I'm finding with caffeine, for example, long-term coffee use actually impairs liver function. Even though the research is showing coffee is really healthy for people, long-term coffee use impairs liver function, so diminishes the processing of lactate. Also, certain food, and if you have a high sugar diet, of course, there's high sugar is converted to lactate very fast, and so you just have higher levels with that. Caffeine also stimulates your adrenal glands and to produce adrenaline, and when you produce adrenaline, your body releases more sugar, and you get shallow, rapid breathing, right? And so with more sugar and high stress levels, the liver function is impaired, and processes processes the sugar and the lactate more ineffectively. And that's why you see higher anxiety levels when you're stressed and you're drinking caffeine, which also stimulates adrenal function.
Right, great. And there are some people that are more prone to the effects of lactate, high levels of lactate, and there are some people who are more affected by coffee. And I'm really glad you bring up coffee because it is such a big factor for so many people when it comes to anxiety. I have so many of my clients noticing such a big difference when they get off the coffee, and it is such a difficult thing for so many people to do. It's this drug of choice that so many people, hold on to, and they don't want to give up. And when they do, they often say, I can't believe how much better I feel without it, how much less anxious I feel, and that I thought I really, really needed it, and I don't. But of course, we've always got to look at the underlying reason as to why someone may need coffee in the first place. Is it the adrenals? We've got to address that so they're not having to use this crutch of coffee. So I'm really glad that you support me on the coffee, because there's a lot of people who are saying, yes, coffee has all these good benefits, but certainly for a lot of people, it's not a good idea.
Yeah, we need to look at the individual, what they're suffering with, the health of their different organs, whether they can tolerate coffee, how much they're taking, how long they've been used it. All these factors are important, Trudy.
Mm-hmm. Yeah, they really are. So we're going to come back to some other things that you can do that'll help with the sluggish liver. Coffee is one of them. We're going to talk about some foods, and we're going to talk about some nutrients. But before we go there, let's just talk about another way that where we can see this connection between the liver and maybe some mood problems. And this is the thyroid, because the liver and the thyroid are very, very connected. Can you talk a little bit about that?
Yeah, there was a beautiful article written by Malik and Hodgson, which really explains the connection between the thyroid hormone and the liver function. Basically, thyroid hormones are processed by the liver. Some of the conversion of T4 into active T3, which is a thyroid hormone, requires healthy liver function, right? So if your liver is sluggish, you'll have lower levels of T3. And low levels of T3, of course, are related to feelings of depression, anxiety, and mood disorders. And then vice versa, your thyroid hormones actually improve the function of your liver cells amongst all the other cells in your body. So if you have a low thyroid function, your liver function will be compromised, right? And as we know, your liver produces bile and a lot of other hormones in your body. So low thyroid function means low liver function, which means more constipation, more hormonal imbalances. So you'll see hormonal imbalances with a compromised thyroid function, right? So you can see it's a synergistic relationship. Mm-hmm. Thyroid hormones are necessary for good liver function, and good liver function are important for good thyroid function.
Great. Now I can really see how it is the master hormone. It's tied to so many different areas in the body. Wow.
Yep, definitely.
And then I just wanted to mention that some of these papers and studies that Ameet is mentioning here, we'll make sure that they are available on the blog for this particular topic. So this one that he's talking about is by Malik and Hodgson, and we'll make sure that there's links to these so you can go and read some of these as well. Yeah. So before we go into some of the treatment recommendations, tell us what would make us suspect that we may have a sluggish liver?
So a lot of people with anxiety or depression, they either have adrenal fatigue or leaky gut syndrome, and often there is a liver picture involved. What I look for is digestive symptoms, first of all. Gas, bloating, constipation is very common because of low bile function, low bile production. And also hemorrhoids. Hemorrhoids because there's veins in your rectum that go to the hepatic portal vein, which is part of your liver. So if your liver is sluggish and tight, this vein backs up, and the blood in your veins in your rectum also backs up, so you'll see hemorrhoids. So key treatment for hemorrhoids is actually flushing your liver. For women, you'll often see breast tenderness, clotting during menses, a lot of cramping, some irritability. That's both for men and women. And with compromised liver function or liver Qi stagnation, you also see insomnia, especially between 1 and 3 in the morning, which is the Chinese medicine time for the liver. So these are all the symptoms I look for, Trudy, when assessing whether there's a liver involvement with anxiety and depression.
Excellent. I'm glad you mentioned the 1 to 3 a.m. because that's a good clue that something might be going on. What about other things like stool color alternating from a lighter color to a darker color? Is that something that you have? Do you have your patients look at their stool to see what it looks like?
Whenever there is irregular stool, I'll often treat the liver because liver is compromised. Sometimes irregular stool is because of food sensitivities and inflammation going on in the intestines. But because if there is inflammation in the intestines, there's usually toxicity in the body. So the liver still needs to be treated as well as repairing the gut.
Okay. Okay, great. And then someone may also not be able to tolerate high-fat foods because they're not producing enough bile, which is needed for the fat digestion. Would you say that that's a fair statement?
Exactly. Definitely.
And then quickly, let's just talk about gallbladder because a lot of people end up with gallstones or gallbladder attacks and then they get their gallbladder removed. And I just feel it's a very unfortunate situation because a lot of doctors will say you don't need your gallbladder, and unfortunately we do. And any comments on that? Would you say that, it would be better to hold on to your gallbladder? I'm sure you would say that.
I definitely think so because each of your organs have meridians, right? And each of these meridians connect to their energetic lines that connect to other organs. And so they have functions not only physically, but emotionally as well. And with gallstones and stuff like that, you're looking at high cholesterol levels. So if you have a healthy liver and less inflammation going on in your body, your cholesterol levels are often lower, and therefore you produce less gallstones and keep your gallbladder healthier. Okay.
I'm less concerned about high cholesterol. I'm more concerned about the fact that you don't have this repository to store the bile, and you're removing something from the body that you actually need. So, I'm more concerned about low cholesterol, but that's okay. I think we've covered, why to suspect that your liver may be sluggish, and I'm glad you mentioned the blood test because often it won't show up in the blood tests that there is something going on. If you did see something in the blood work, what are the markers that you would look at?
You're looking at the transaminase enzymes, so it'll show up as ALT and AST, and other enzymes you're looking at is alkaline phosphatase and GGT as well. Okay. So these are all the markers you're looking for. Okay. And I actually look at blood work from a functional point of view, so I look at much narrower ranges. So keep in mind if you're getting blood work from your doctor, the range that you're seeing is, really, really wide because it's the average population that isn't terribly healthy. And we want to be looking at much narrower ranges. So sometimes we'll see, for example, the ALT or the AST a little bit elevated, but it's not outside the lab range. And that could be a clue that maybe you need some liver support. Definitely. Yeah. Okay. So, Ameet, let's talk about some of your treatment recommendations. Let's first talk about some things we want to eliminate. And we've talked about coffee, so we're good with that one. But what about, and obviously with the elimination, it would be the sugar as well, the alcohol, which is going to increase the lactate as well. Anything else that we might want to remove? Basically, coffee, sugar, and toxic foods, processed foods, all those things that add toxicity to your liver need to be removed, right? And the other reason why we remove coffee during anxiety, Trudy, is because coffee stimulates your adrenal glands without nourishing them. And a lot of people with anxiety have adrenal fatigue, or the adrenal glands are not properly balanced. So we don't want to stimulate them during anxiety, right? We want to remove stimulants so that they can rest and recuperate. Okay. Really good. Really good. What do we want to do when it comes to diet in terms of supporting the liver? There's just so much that we can do in terms of adding some lovely foods that are going to actually help support the liver. Yeah, beautiful question, Trudy, because that is the fundamental treatment for your body is through diet, right? And so eating lots of bitter greens, bitter foods, they stimulate bile productions, right? So you're releasing toxins and stimulating your liver really to squeeze itself clean. And then remember, the liver processes a lot of toxins. So it's prone to oxidative damage. So you need a lot of antioxidants, right? Your berries and your beetroot and those sort of foods that protect your liver cells and help them repair from oxidative damage. And the third thing you need is a lot of fiber, because when you're detoxifying, you need fiber to bind to the toxins in your intestines and pull the toxins out through your feces. So have lots of green foods, which are very leafy, to provide a lot of fiber and a lot of mixed berries.
Great. And obviously these foods that we're eating should ideally be organic or not sprayed with pesticides, because otherwise you're adding in additional toxins into the body that the liver's got to try and deal with.
Exactly. So if you're juicing and trying to heal your liver, whether it's anxiety or cancer, do organic food, because you need to get rid of the toxins.
Right. Good. Now, something else that you talk about, which is very interesting, and it's not something that I'm terribly familiar with, is deep diaphragmatic breathing. Tell us why this is important, and then let's just talk about how you would do this.
I came across this concept that I found very interesting, actually. Somebody told me about this. Basically, your liver is below your diaphragm, right? And when you're stressed, you're breathing very shallow. And shallow breathing means you're only using the upper part of your lungs. And that's why people get tight neck muscles when they're stressed, because they're just using those muscles at the top here to help their upper part of their lungs breathe. That means you're not taking full deep breaths, so your diaphragm is not going down enough. And the thing is, Trudy, when you breathe deeply, when your diaphragm goes down, it actually massages your liver, so it helps in the detoxification process. That's why now we see people who are stressed, their liver becomes sluggish because they're not flushing it out. And it's well known in Chinese medicine, they always say that stress goes to the liver. And this is why. So really, to help your liver detoxify, deep breathing is very important. And that means basically breathing deeply, like letting your, basically called belly breathing. So breathing deep so your belly expands first and then bringing the air all the way up to your lungs. That means you're really pushing your diaphragm down, which massages the liver really well. And do this, do 10 deep breaths 3 times a day, and you really help your liver out.
I love it. And I love that you talk about massaging the liver. What a beautiful concept.
Yeah, we don't get enough massage in this world nowadays. I think we need to go back to grooming each other.
Exactly. So 10 deep breaths, you say 3 times a day?
That would be wonderful.
Excellent. So just talk a little bit more how you would do this. So you would breathe in from low down and then hold your breath, or what do you want to? How do you want to do this?
You don't want to hold your breath for too long. No, it's just sit in a relaxed position. Make sure you're comfortable. And if you're running around doing office work, just find a quiet place to sit for a bit and take a deep breath. Focus on your breathing first, right? Just focus on your breathing. And then take a deep breath and let your belly expand first. And let the air fill up slowly up to your chest. And then breathe out slowly, releasing from the chest first. Then lower down until your belly becomes empty. So really slow your breathing down. And then the next deep breath, you expand your belly first. Let the breath go up and fill your chest. And again, and you can do this while you're listening to this seminar. And then release the breath. Slowly releasing it, emptying your chest, and finally down to your belly. And do 10 of these, 3 times a day.
Excellent. Love it. And it's so interesting because as you're talking about it, before you walked us through it, I immediately started thinking how I was breathing. And you will, once you've heard this, you'll start thinking about how you're breathing and realize how quick your breathing is, how you're not doing that deep breathing. So that was a great exercise. Thank you for sharing that.
A pleasure, Trudy. Pleasure.
Really important. Okay, so now the other topic again, something that I don't use in my practice, but I know about as being beneficial, is homeopathy. And I know you talk about this as well as being beneficial for the liver. So let's just talk a little bit about how homeopathy can help with a sluggish liver.
So homeopathy is really the magic of life for me, because it's very dilute substances made out of nature, and they're diluted so many times, so much that there's no toxic substance left in the final remedy. And it actually works by stimulating the energetic forces in your body. And what I find is homeopathy really helps to treat the root cause of disease without suppressing any symptoms. And there's certain remedies that are really good for liver function, and I'll mention them here just so that the listeners can have a repertoire of remedies available. The first one is Nux vomica. It's excellent for when a person has stress, constipation, and irritability. Lycopodium is also a great homeopathic remedy, and usually people with a lot of gas and bloating will do well with lycopodium. Other remedies include chelidonium, phosphorus, and china. These are all great liver detoxifiers, and I definitely recommend seeing a homeopathic doctor or a naturopath who specializes in homeopathy to find out what's the most indicated homeopathic remedy. It goes really well with the herbs and other treatments. Okay, great. And I'm glad you mentioned finding someone to work with, because it's with the homeopathy, it's not just a matter of use this. There's a lot of symptoms that are very specific to the formulation. That's correct, isn't it? Absolutely. You need definitely to find, you need to look at your unique symptoms, including your dreams, your food cravings, and all that, to determine the best homeopathic remedy for you. And that way you'll also get the best results, right? Right. So can you just mention those again, just in case they're new to some people? Yep. Nux vomica, lycopodium, chelidonium, phosphorus, and china. Those are the big liver movers. Okay, great. And do you find that homeopathy is something that you use with most of your patients, or is it on a obviously it's on a case-by-case basis, but I'm just wondering if this is a big part of your repertoire? Homeopathy is probably used with every single patient that comes into my office. Unless it's like back pain or something, then I'll use bone therapy. But homeopathy treats the root cause of disease. It also releases emotional experiences from the past. So you can actually release trauma using homeopathic medicines. Very interesting. Yeah, so it's really the key treatment that I use in a lot of my practice. And then I do a lot of charity mobile clinics in the north, and that's the only thing I use is homeopathic medicines. Oh, fantastic. This is when you're doing the work with the underserved communities? Yeah. Homeopathy works really well for these communities. They love it. Oh, fantastic. That's wonderful. Yeah. Okay, so now we're going to talk about some of the nutrients that I'm more familiar with, that I use in my practice, and a lot of nutritionists will obviously use, and other holistic and integrative practitioners would use as well. And this is some antioxidants. You talked about how we've got this need for antioxidants when we've got the sluggish liver. So let's just talk about a few that may be beneficial, and then we'll talk about some of the herbs that are very beneficial.